Hello friends, I hope everybody is good. In this video, I want to give some information about the Rezum treatment in chronic prostatitis patients. We have many patients with chronic prostatitis and we usually treat them with the prostate massage technique. We empty the prostate with prostate massage, we drain the inflammation in the prostate, and then we give antibiotics and we a couple of times, averagely 6 times, we do this procedure and try to get rid of the prostatic infections. But when we drain the prostate and cure the prostatic infection, the prostate begins to fill again with the inflammatory fluids, because the structure of the prostate, inner structure, is destroyed with the infections, chronic infections. And even we clean it completely, the destructed structures begin to fill again after we completely finish the infection. So what we do, we try to repeat the sessions. Usually after 3 months, we do another session. Maybe after 6 months, we repeat it. And then yearly, we try to call the patient for another sessions of prostate massages. So some of the people ask us, is there a complete solution for this chronic prostatitis? Rezum technique may be a complete, total treatment for chronic prostatitis. The necessity of repeating the massages may be completely finished, but it's too much expensive. Because of the device, you know that device, we have to use this cystoscope gun in every case, and it is not reusable. We throw it away, so this costs a lot of money. And for an inflammatory disease like chronic prostatitis, we don't choose to use Rezum technique at the beginning. But if the patient is, if the patient is very young, like 30, 40 years of ages, this is unnecessary. But in some patients like 50 years of age or over 50, they have additionally prostatic enlargement, additionally to the chronic prostatitis, prostatic inflammation. In such a case, if the patient has difficulty in making urine, but he still doesn't want to have conventional operations like TURP, like HOLEP, which will cause retrograde ejaculation and some possibility in leaking urine or some dysfunctions in sexual activity, but mainly retrograde ejaculation. And he has also chronic prostatitis in addition to his urinary tract obstruction. We can choose Rezum treatment. What we do in this treatment, we combine the Rezum with prostate massage. Let me show you a patient who we did prostate massage before Rezum. Here, you see this is inner side of prostate. We come back to, you see the lateral lobes of prostate which are occluding, and you see some kind of inflammation is doing. Now we are doing prostate massage. You see the inflammation going out from the prostatic channels. You know, prostate has secretory glands and the channels open next to the verumontanum. You see, I now press the right lobe and we try to drain the prostate. It is important for me to drain the prostate in chronic prostatitis patients because the heat energy, the steam energy will go inside the prostate. If there is fluid inside the prostate, it will lessen the effect of, it will decrease the effect of this heat energy. These inflammatory secretions, fluids, they will decrease the effect of our heat device, steam device. So before the procedure, we choose to make some prostatic massage to see if there's any inflammation inside the ribs. Usually, recently, we do it to every patient, even they complain from prostatic inflammation or not. We want to see if there is any fluid inside the prostate because we want the heat to be in touch with, directly in touch with the prostatic tissues and be effective. It will be effective more. Here you see This is our device. This is the needle. And now we drain the prostate. It takes 2 minutes. It's really easy. We just put one finger from the anus rectum and we press the prostate maybe 30 times in each lobe, and it will drain the inflammatory secretions fluids. So then we begin the operation. And in Rezum procedure, it's very non-invasive. The bladder, the prostatic mucosa, the red tissue covering, the tissue covering inner side of the urethra, prostatic urethra. The important part is we don't touch to this mucosa. This will stay untouched, and this is the key point of this procedure. Because if we destroy this mucosa, it has a Teflon effect. It will not stick onto the next mucosa, the opposite mucosa. So the urethra will never be closed after this operation. And we want to destroy the prostatic tissues inside, deep inside. So as you see, we calculate 1 centimeter distal to bladder neck, and this needle is just, we shut it inside first. You see the swelling of the tissues with the steam. This steam is like a boiling water. It will burn the tissues inside the prostate, but it will never destroy the mucosa. So even you have a small opening, small tissue decrease inside the prostate, it will help the patient. We come 1 centimeter distal and we shut the needle again. It's very easy. The operation usually needs 7 or 9 shots like this. Every shot lasts 9 seconds. We give the boiled steam. Boiled steam is more important than boiled water, because when the steam is turning into water, it gives out too much energy, and it really helps the tissues to be destroyed. Yes, this is the left prostatic lobe. You see the needle here. We shut it. We give coil inside. And this is the right prostatic lobe. We do the same things here, and the procedure lasts 5 seconds. So in this video, I want to mention, if you have a chronic prostatitis, it's possible to be treated with this Rezum technology, but it is too much expensive. Turkey is one of the countries which we can do it in the cheapest way, because the hospital fees are less than European countries or United States, and the hotel fees, everything, but still look at the inflammation going out when we give the steam. But still it costs a certain amount. So in a young patient, if they don't have urinary obstructive symptoms, we recommend prostatic massage therapy, which is far more cheaper. But if you want to get rid of your prostate because of the obstruction, the Rezum technique is preferable. But emptying this inflammation before the Rezum procedure will help you more, will give you more advantage, or will be more beneficial. Thank you for watching.